Safe squat after stroke, step by step, with 8 real patients. Hi friends. Welcome back to another video with Dr. Rehab. Today, I'm showing you one of the most well-known and powerful exercises out there, the squat. You might think, wait, isn't that just for athletes? Not at all. The squat can be a game changer in stroke recovery, if it's done the right way. So, who can actually do this movement? Is it safe after a stroke? And how can we adjust it for different levels of ability? In this video, I've worked with several stroke survivors at different stages of recovery. You'll see how we adapted the squat to meet their unique needs and abilities. Stick around. This could be a big step towards standing stronger again. And don't forget to like, comment, and subscribe so we can keep going together, one step at a time. But wait, there are some important things you need to know before trying this movement. So make sure you watch till the end to avoid common mistakes and stay safe. If you find this video helpful, please share it with your friends and someone who might need it. In this video, we can see the patient's walking pattern. There are several issues, and they're not putting enough weight on the affected leg. That's why we're introducing the squat exercise here. During this exercise, several important muscles are activated and strengthened, including the gluteal muscles in the back of the hips, the quadriceps in the front of the thigh, the hamstrings in the back of the thigh, and the calf muscles. It also has a strong effect on the core muscles, which play a crucial role in stroke recovery, but are often neglected during rehabilitation. Of course, the primary role of the squat is to strengthen the quadriceps muscles. To start the exercise, the patient places their feet shoulder-width apart, with the toes pointing slightly outward. At the beginning of this exercise, the patient should hold on to something for support and use a chair behind them to practice sitting and standing. This is called the sit-to-stand exercise, and it's a great way to start building strength safely. Repeat this exercise for 3 sets of 10 repetitions each. Take a short rest between sets if you need to. The key is to stay consistent and safe. Now that the patient has gained better control, we can move to a more challenging level by removing the chair. At this stage, the patient performs the movement with a smaller range of motion to keep it safe and manageable. The reason we're keeping the movement small right now is because going too deep causes the patient's knee to collapse inward. This is called knee valgus. Since that's not the pattern we want, we're limiting the range of motion for now, so the patient doesn't build bad movement habits. Here, you can see another patient who has more control and is performing the squat without using a chair. They're trying to use their affected hand for support. But we can't allow that yet, because the hand still doesn't have enough strength or function to be a safe support. We ask the patient to stand with their feet slightly wider than shoulder width, and to keep their toes turned slightly outward. This position can be helpful when we want the patient to shift weight evenly onto both legs, especially onto the affected leg. But if the patient is still putting too much weight on the stronger leg, then we bring the feet back to shoulder width to encourage a more balanced stance. Proper foot placement helps train the brain to trust the weaker leg again. After a stroke, people often overlook the core muscles. But if the core is weak, it's like a heavy weight pulling down on the legs. That makes walking and balance even harder. If you're interested, I'd be happy to make another video focused on improving core strength during stroke recovery. So let me know. Leave a comment or give this video a thumbs up and I'll make it happen. Our third patient has relatively good movement, but due to a fear of falling, we allowed them to perform the squat with hand support. Even when movement is good, fear can still limit progress. And that's okay. We just adjust the exercise to build confidence safely. This movement was also performed similarly by patient 4. The same exercise was performed by patient 5 as well. There's a posture issue in this patient's movement. Can you spot it? Take a close look at the position of the neck during the squat. But here's an important reminder. We need to pay close attention to spinal alignment and the position of the head and neck during the squat. The patient should not hunch forward, because that puts unnecessary pressure on the spine. It's also best if the head and neck move in line with the spine, keeping the gaze steady and moving naturally with the body. This helps maintain balance, posture, and safety during the movement. Our fifth patient is Nema, who has made great progress and is very confident and brave in his movements. I'm standing nearby just to make sure he feels safe, but he performs a full squat without using his hands for support. He follows all the correct steps, first bending at the hips, then at the knees, so there's no extra load on the knees. His sit-to-stand range is also well controlled and appropriate. When patients reach this level, we can begin to add variety and purpose to the exercise. Starting with a wand and later moving toward light weights for progression. And finally, we have our youngest patient, who's performing the squat on a balance board, and he's actually really enjoying it. It's a great way to challenge coordination and stability, while keeping the exercise fun and engaging. In this video, you saw several stroke patients doing the squat exercise to the best of their ability. Some were weaker, some were stronger, but in my opinion, none of them were quite ready to use weights yet. That's because using weights requires not just strength, but also good balance and a certain level of arm and hand control, which they're still working on. So for now, I chose not to give them weights, but I truly hope that very soon, I'll be able to share a video of these same patients doing weighted squats with confidence and strength. Recovery doesn't have to be boring. Movement can be powerful and enjoyable. Thank you so much for spending your time with me today. I really appreciate it.